Sound check. Sound check. Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way, Yorkville. Happy Monday. Happy St. Patty's Day, guys. It's good to see you. I know I've been out for a couple of weeks. I did lose my Facebook account. I was trying like crazy to try to get it back because I couldn't go live unless I had this Facebook account back. And today I got it back. So I'm like, let's go live. I'll explain to you why I am doing this topic here in just a second. So hope you guys had a great weekend. It's good to see you guys. Last week, it was my birthday. It was my birthday. So I wasn't going to go live anyway, but I couldn't have gone in anyway. So I've got it back. I'm like, let's go live and let's give people some awesome, relevant information that they can take to improve their health. So tonight, I'm going to talk about statins and fatigue. Okay. Statins and fatigue. I'll explain to you why I'm going over that topic here in just a second. But if you are watching live, do me a favor, please say hello. Let me also know where you're watching from. I always love to see where people are watching from. And if you're watching on replay too, just let me know. Just type in replay and also where you're watching from. I always love to see, that people are getting values through some of the pertinent information that I'm going to share with you, obviously, tonight. So statins and fatigue. This is an interesting topic because I will tell you, give you a preview. Yes, statins can absolutely cause fatigue. I'll explain to that why that happens in just a second. But I would probably say that a lot of people who come in, one of their primary complaints is in fact fatigue. And fatigue, there's multiple factors that are going on, but statins can actually be one of them. All right. And here's the reason why I'm going over this topic, because on Friday, I did a reel on Instagram. So I couldn't necessarily post it to Facebook because I didn't have access to it, but I could post through Instagram. And so I talked about some of the side effects of cholesterol lowering drugs that are actually, you can actually find them. I'm going to explain to you why some of those things happen. And I said, here's some of the symptoms that you can get from being on a cholesterol lowering drug. Share your experience below. And within a matter, it's only been it's been about 2 to 3 days. So not much over 48 hours. And there's been almost 500,000 views on it. And you can see there's a lot of comments on it. And if you look through and you look at people's experience with being on it, pretty sad that you see people suffering so much and that the doctors just kind of blow off some of the effects that can take place from being on a statin drug. So there's a lot of comments that are sad. There's also a lot of comments from trolls, as well. But here's one of the things with social media is when you're on social media, you have to make sure, because I know a lot of people, they just love to, on their Instagram account, they love to go private because they don't want people to troll them because it's going to make them feel bad. But you have to be willing to be misunderstood and have to be okay with it to be misunderstood, because anytime that you have, anything over 10,000 followers, then there's going to be people who are going to just creep their way through. And if you've ever seen the meme with Danny DeVito, like crawling through a couch, that's what people do. They don't comment until you say one thing that they're going to disagree with, and then they're just absolutely flabbergasted. So you have to be willing to be misunderstood. But I'm going to explain this, why. And in fact, most of the people who had very, kind of trolly comments, they don't even probably have the patience, that they don't even care to know what the truth is, because they're not interested in the truth. They're just interested in try to make people feel bad in order to spread their hurt around. Remember this: hurt people hurt people. That's one of the things that you have to understand. So I'm going to talk to you physiologically why they can cause such problems with fatigue. It'll make a lot of sense. But one of the interesting things is that, if you do a reel, they really can only be about a minute long. And so people will always complain. So if you go longer than a minute, they complain that you went too long. And if you go under a minute, you can't give you all the physiological reasons why, then they complain that you're not giving them enough information. So you can't make everybody happy. However, if you're a loyal follower, let's go over a couple of pretty awesome things that you can dive into a little bit further. Dr. Patrick Flynn, with The Wellness Way, has actually discussed this in great, great detail. And you can find, if you want more information, because I'll go over with it pretty well as far as how this is pretty well researched and why it can cause so many issues. But if you want a lot more information, a lot more in depth, go ahead and go to thewellnessway.com/ADP. If you go to the Wellness Way, you'll be able to find it. But if you type in /ADP, a different perspective ADP, and you'll see that Dr. Patrick has a 5-part series on cholesterol and statins, and he breaks it down absolutely beautifully. So I think this would be very important for you to start learning this, because a lot of times, people are just like, I'll take your word for it, and then I'm going to just go tell other people. I'm like, don't take my word for it. And in fact, anything that I go over with you, I'm like, don't take my word for it. And that's why we give a lot of biochemical reasons as far as why certain things are actually taking place. But if you want to look at this in a lot more detail, go to thewellnessway.com ADP. And you'll be able to watch literally 5 videos on cholesterol and statins. And he breaks it down beautifully, why there can be such negative effects that are taking place with it. Okay. Now, here's one thing that's really interesting, because people are like, well, what on earth am I supposed to do? And I will actually tell you this, is that most doctors, they don't even read research. Yes, any kind of doctor doesn't read research. And in fact, what they do is they're just told what to do. And so they're literally not much more than just clinicians that are just following, just a list of things in order to do. If you have high cholesterol, go ahead and recommend this. But if they are reading their own research, they probably would be looking a little bit deeper, because even if you look at cholesterol and the role of small intestinal bacterial overgrowth in the pathogenesis of hyperlipidemia or high cholesterol, okay? So if they actually were reading their own research, they probably would find, gosh, there's a role in the gastrointestinal system as far as like what's happening with hyperlipidemia or having high cholesterol. They would see that. And in fact, there's researchers that are looking at this. And yes, even if you look at some research about the role of gram-negative bacteria and how that can actually increase lipoprotein (a), which is probably one of the most atherogenic cholesterol particles that are out there. You ask a cardiologist, they're going to be like, I don't know what to do, because the statins don't even touch it. But there is actually a role. And this is why even getting a stool test, can it start to decrease cholesterol? Yeah, because if you look at, the role of certain gram-negative bacteria and how they can cause the liver to start producing lipoprotein (a) as a protective mechanism from some of the toxic effects of what these bacteria are actually secreting. So you go ahead and type that into PubMed, and you can look at that article yourself, or you can go to ADP and you can watch the 5-part series, and he'll break it down perfectly for you. So getting into it, guys, coming up tomorrow. So it's St. Patty's Day today. Tomorrow is my former youngest son, Jacoby, former youngest child. It's his birthday tomorrow, but I will be doing an inflammation event Tuesday, March 18th. This is an in-person event. If you're from the Chicagoland area, you want to work with us directly, make sure that you get registered for this in-person event about the approach to inflammation. And guys, one of the things I try to break down for you um, in great detail is how inflammation literally leads to every single chronic degenerative illness that's out there. And yes, it can lead to problems with weight loss, the ability to be able to lose weight. Yes, cancer is just a long-standing inflammatory process. Infertility, your hormones are directly related to inflammation. Thyroid disease, in fact, most thyroid diseases are actually due to an autoimmune reaction. So you got to figure out, why is the body responding that way? Chronic joint pain or arthritis, type 2 diabetes, autoimmune conditions, which most thyroid issues actually are, and even hormone balance. And people are talking about, balance my hormones. I'm like, you have all the feedback loops in the body that help to regulate your hormones. And in fact, if your hormones are going haywire, it's because maybe the body is trying to adapt to doing that. And so you need to figure out how the body is adapting and why the body is adapting to that. But one of the biggest things I want you to learn at the inflammation event is that maybe the body isn't messing up. Maybe it's just trying to adapt. And during that adaptation process, the body trying to live as long as possible. Maybe one of the things that we're doing is we're calling it sickness, illness, and we're trying to throw a bunch of supplements and a bunch of medications or hormone replacements at that. So that's one of the biggest things that you have to understand. So if you're from the Chicagoland area, our next event is going to be tomorrow night. That's Tuesday, March 18th at 6:00 p.m. This is an in-person event. All you have to do is just go over to our link tree. And I didn't put that on there, but if you click on our profiles, you'll see Linktree, and at the very top, you'll see register for the inflammation event. So that'll take you to Eventbrite, take you 30 seconds to register for it. I think we may be, I apologize, we may be sold out, even though it's a free event. We may be registered out, or we may be at capacity for that, but you can go ahead and check and see. And if it lets you in, that means that we do have some capacity for to be able to see you. So get registered for that, and that'll help bridge the gap as far as where you're at right now, and especially where you need to help, or where you need to go moving forward. In addition to that, I keep getting reminded on social media, but we did this a year ago, and this was our You Don't Know Squat Challenge. This was your You Don't Know Squat Challenge. So basically last year, one of the things that we did is I told people, do this every day for the next 30 days in order to improve your squat. And people were coming back and they were emailing me, they were messaging me. They're like, oh my gosh, my squat got so much better. And here's the thing, if you can't squat, it's the beginning of the end. It really is. The squat is an innate movement. You don't need to be taught how to do it. In fact, my 2-year-old can squat perfectly. And if he can't squat perfectly anymore, it's because he's lost that gift. And so one of the things, if you've lost the gift, you have to work on getting back that gift. And in fact, one of the things that you can do is you can go on to my Instagram page, Dr. Nathan Thompson. You'll see that video pinned. I think it's at the very top. You also will see it on, probably will be able to find it on YouTube, probably be able to find it on Rumble. You'll also probably be able to find it. Gosh, I'm losing track of all the social media accounts that I have. But if you go there, you'll be able to see that video. And I know it's pinned on Instagram, and it's a short video. It shows you all the things to do in order to help improve your squat. And one of the things with improving your squat is it's not like I do it once and it's going to magically get better, but it will get better over time. So consistency is one of the things that's going to be king. So if you want to become better, if you want to become more mobile, if you want to become, able to pick things up and just be generally better at life, then make sure you check out that video and especially start doing it. So statins and fatigue, let's go into this a little bit. So this video that I did, you'll be able to find it on Instagram, which is now, I think it's getting close to 500,000 views. But I talked about what are some of the effects. I don't call them side effects, because they call them side effects as if they're like, oh, this isn't supposed to happen. I'm like, well, it's supposed to happen just based on how the drug works. And if they don't like the effect that it has, they call it a side effect. But one of the biggest effects that you're going to have is known as exertional fatigue. And that's one of the first things I said, yeah, it can cause exertional fatigue. So that means you exercise and you're just done. You're toast. So any kind of exertion can cause a lot of fatigue, and it can cause some other things too. You can see some elevations of your A1C or average blood sugar. You might see some decreases in testosterone. This just has to do with how testosterone created, how its cholesterol is actually needed in order for that to happen. But exertional fatigue is probably one of the biggest symptoms that people have. They may also have muscle aches or things like that. The thing is that what I'm going to show you is that this is probably way more common than what people have realized, because people say, oh, well, such a minuscule amount that it's negligible. And I'm like, it's not a minuscule amount. I'm going to show you in just a second. It's just that nobody had told you that this could be an effect of being on any kind of statin drugs. But they're just not taught that. So they're just not taught to start looking for some of the symptoms they might having and start to do something maybe that's a little bit different. So um, even though I went over facts, man, people they just lost their marbles, when it comes to that. And remember, it's easier to trick the public than it is to convince them that they have been tricked. Here's a perfect example, because I've had certain videos that have over 12, 15 million views been taken down, and it was in regards to the COVID vaccine. And I'm going to tell you something, because I went over my findings based off of labs, and I said, here's what I believe is going to happen. And I was 100% right. 100% right. You can't find it on YouTube. You might be able to find it on Rumble as well, but YouTube took it down, after 1 million views, because they didn't want this getting out. So, but I was 100% right when it comes to some of the effects and what can happen with the COV, et cetera, jibby jabby. And I'm just talking about a different medication. And if you have a problem, because there's some medical doctors that have a problem with doing that, and I'm like, well, that's because I'm taking away basically your God. That's literally what it becomes. Is it becomes your God. It becomes your idol. So let's talk about why this can cause some kind of fatigue. So if you look at cholesterol production, which primarily is happening within the liver, and in fact, if you look at these statin medications, they're known as HMG-CoA reductase inhibitors. So you can see how cholesterol is made. It goes down all of these different pathways. So it's like, in order for this to be made, it has to happen a step before. And it keeps going down this pathway. And in fact, finally, until, squalene, ubiquinones, in order that for cholesterol to be produced, but also something very important known as CoQ10. So if you look at these medications, like Lipitor, for example, it's known as an HMG-CoA reductase inhibitor. And in fact, one of the things that you will see is it inhibits that process and inhibits this pathway, so that you're going to see a lowering of cholesterol. But here's one of the interesting things. So when you take a statin drug, not only is cholesterol reduced, but also a vital nutrient that you need called coenzyme Q10. And the reason why just look at your biochemistry, and you see anytime that you're interfering with that, you're interfering with coenzyme Q10, which is vitally needed during the Krebs cycle, which is an aerobic energy process. And in fact, Krebs cycle gives me nightmares because we had to learn it in biochemistry. And but if you look at this, in order for ATP, which is basically the currency that your mitochondria use in order to produce energy, it starts to get blocked. And this is why, if you look at this, why anytime that you're needing like your muscles in order to move or to exercise or to lift, and you're using them a lot, you're seeing a decrease in ATP production, which is why people on statin drugs, why they can get so many muscle aches while they're on it, or muscle pain or muscle aches. And it's kind of like this. What do you think of this? Let's say you had 100 people in your house in a very specific room, and they needed to get outside. And in order to get outside, they had to go through 3 doorways. So they had to go through the first doorway into another room, second doorway into another room, the third doorway, finally get outside. And in order for that to happen, all 3 of those doors have to be open. But let's say you decided, I'm going to lock one of those doors. So then one of the things that happens is that they may be able to get into the next room, but then that door is locked, and then they can't get into the next room. Finally, they can't get outside. This is kind of like, what I used to do many, many years ago, which is known as organic acid testing, or an oats test, organic acid testing, because basically it's testing those certain things. Because it's kind of like if you stood outside and you're like, I don't see anybody out here. Then you go into the first room and you may see only 50 people in there. And then you see where the people are getting stuck, where the door is actually being locked. And then you see where these people are stuck. And you're like, oh, okay, this pathway is stuck. And here's what you need to do in order to start unlocking that pathway. You may say, hey, why don't you do that anymore? And here's the reason why is because organic acid testing really should be something that you should be getting after you've been working on fixing a lot of things for a long period of time. So I don't even do it anymore. And the reason why is because you may see a certain biochemical process being stuck, and your only solution is just to throw a bunch of things at it, but it's not telling you specifically why. And this is why you really need to start fixing things from the inside out. And an organic acid test might be a good thing after a year of really doing a good job of fixing certain things and things like that. But I certainly don't think it's the right approach if that's the very first thing you do, because it doesn't give you a whole heck of a lot of direction. And it doesn't tell you really a lot about inflammation and things like that. But we do a little bit of organic acid testing, especially when we do the Dutch test, because that does include some organic acid testing just to look for some inflammatory markers or some things that could be associated with gastrointestinal dysbiosis or abnormal life within the gastrointestinal system. It'll look at, some of the inflammatory markers. It'll look at oxidative stress on the body. So it give you a couple of clues in regards to that, but I don't think that's the first thing that you should actually be pointing to. But when you look at a statin drug, basically what it's doing is it's just locking the door. So it's inhibiting the production of things moving forward, especially. So you can see how it will block the production of CoQ10, but there's more to it than that. So coenzyme Q10, let's go to the Mayo Clinic, because when everybody gets sick and they need to figure out something, they're going to Mayo's. So here's what Mayo Clinic actually says about CoQ10. CoQ10 is an antioxidant that your body produces naturally. Your cells use CoQ10 for growth and maintenance. Is that true? Absolutely. Levels of CoQ10 in your body decrease as you age. Can that also be true? Yes, it can be true. CoQ10 levels have been found to be lower in people with certain conditions, such as heart disease, or in those who take cholesterol-lowering drugs called statins, okay? Now, where is CoQ10 actually found? So the Mayo Clinic is actually saying, yeah, this happens, but CoQ10 is very abundant in certain tissues like the kidney, like the heart, skeletal muscle. It's also very, very high in liver. And this is why organ meats can be so beneficial for people. Um, but a lot of people don't like to eat organ meats, including me. So I have no problems taking a desiccated dried organ meat, a desiccated liver, or, a desiccated male glandular or something like that. You could also take a blood sugar glandular. And in fact, there will be kidney in it. There also will be a lot of liver in it, but these are some of the foods that are going to be the highest sources of CoQ10 will be in organ meats. The highest has the highest density of nutrients. This is why liver can be one of the most fantastic things to be able to eat or to take it as some kind of food supplement or something like that. Now let's talk about statins and fatigue, and let's go to the Archives of Internal Medicine 2012. Where'd you find that? On the internet? Absolutely. I found it on the internet. Go to PubMed and you'll be able to find any researched article. Doesn't necessarily mean that it's a good article, but this one coming from the Archives of Internal Medicine, very, very good article. Here's what they say. The effects of statins on energy and fatigue with exertion. So doing heavy exercise really just bowls you over. Results from a randomized control trial. Here's what they say. No drug is without adverse effect potential. That's 100% true. Any drug can have any kind of adverse effect. And fatigue and exertional intolerance are adverse effects reported by patients receiving statins. So this is one of the most common complaints of people taking statin medications are fatigue and exertional intolerance. And what I mean by that is that you exert yourself doing a workout by lifting or by using a muscle repeatedly, and your muscles they just go to garbage, with that. They further on say, although many observational reports have cited fatigue and exertional fatigue with statin use, to our knowledge, no randomized trials have addressed this issue to date. So what is so interesting is that once enough people complain, now they start looking into it. Kind of makes you wonder, right? Why are they not looking into this prior? Or are they just actually saying, here's our next cash cow. Let's take it to market. We'll deal with all the consequences later. They've already done that when it comes to GLP-1 agonists. They've already have done that when it comes to things like Bextra, Vioxx, and Celebrex, things like that. They already know that it was going to cause issues. And then once enough people complained, then they started looking into it. And rather than say, you're getting sued, they just give them a slap on the wrist and give them a fine. So here is the study method. They looked at 1,016 subjects, okay? with no cardiovascular disease or diabetes. They were randomized equally to one group took a 20 milligram simvastatin, one took a 40 milligram pravastatin, or they took a placebo to be taken at bedtime in identical blinding capsules for 6 months. So basically, if you look at a statin drug, excuse me, one of the things you do is you take it at night. What's interesting too is they tell you to avoid anything that could speed up your certain liver pathways to eliminate that drug, like grapefruits. um, but this was dose dependent. So one group took a 20 milligrams, another one took 40 milligrams, and someone took a placebo. They thought they were actually getting the statin drug. So if you look at the results, and I'm going to post the results on the next slide, but just so you know, here's what the results concluded is that energy and exertional intolerance were significantly higher in men and women, but women were disproportionately affected. And in fact, they said 40% of women in this study reported worsening in energy or exertional fatigue. So when someone says, oh, it's just a small amount, oh, it's a tiny amount, it's, or the benefits outweigh the risks, I'm like, nobody's talking about the risks. They also said that 10% of women reported both energy or exertional fatigue as much worse. So we're not talking about, I'm a little bit more tired. It's, I'm just having such a hard time, trying to deal with this. And in fact, if you look at the comments of that video, I've even had medical professionals reach out and they're saying, oh my gosh, I had to just stop it because the fatigue was just absolutely debilitating. So 40% of women reported worsening in energy or exertional fatigue after being on a statin drug. And here's the actual study. They said this: to our knowledge, this is the first randomized evidence affirming unfavorable statin effects on energy and exertional fatigue. Effects were seen in a generally healthy sample, given even just a modest statin doses, and particularly for women, these unfavorable effects were not uncommon. So it's a lot more common than what you think. And their conclusion was this: meanwhile, physicians should be alert to patients' reports of exertional fatigue or diminished energy during statin use. But if any of you are taking statin, how many times you meet with your doctor while they sit behind their computer, entering into their electronic health records, are they even asking you about energy, fatigue, or what's going on with that? In fact, most of the time what they're doing is they're just saying, oh yeah, whatever. Okay, let's just switch you to another statin. As if a lot of times, or let's just lower the dose. And I'm like, well, why didn't you know that that was going to happen in the first place? So here's another article from Pharmacotherapy 2010, and who cares how old it is if it's true. Statin-associated muscle-related adverse effects, a case series that involved 354 patients. Their conclusions were this: this study complements available information on the properties and the natural history of statin-associated muscle adverse events, affirming dose dependence and strong quality of life impact. This is what they're saying, is that the more higher the dose that you're getting, the more this is going to affect your muscles. The data indicating a dose-dependent relationship between muscular adverse event risk and recurrence suggests lower potency statins or discontinuation may bear consideration in order for it to ameliorate symptoms or to get rid of symptoms. So they even said it, that's straight from the horse's mouth, that they're saying is that the muscular adverse events that you might be having is dose dependent, number one, and that doctors should actually should consider lowering the dose or discontinuing it in order to get rid of some of the negative adverse events or some of the negative symptoms that people are associating with. Now you may say this, because I saw this in the comments, but I don't have any problems, therefore it's not true. Well, just watch this. If this is happening in 40% of people, you got to ask the question, why? But here's my question to anybody, because a lot of the people that said, I don't have any symptoms, clicked on their profile, and you can tell that they don't do anything in order to stress their cardiovascular system or to stress their muscles at all. So the question is, I don't have anything that's going on. Here's my question. Do you do any form of high intensity exercise to stress your muscles and your cardiovascular system to even notice if anything is going on? Because the people who tend to use their muscles the most are the ones who are having the most adverse events. And guys, this is what's so interesting is that, I say as you get older, you need to keep moving. You need to keep moving more. But it's almost as if the medications that doctors are giving you are actually making you be fatigued and to move less, which only just worsens the situation. Because it seems this, and this is what my observation is that the individuals with the most side effects are the ones who are using their muscles the most, the ones who are trying to do things in order to benefit their health, but the medication is actually making it nearly impossible for that to happen. The reason why I say this has to do with this article in British Journal of Clinical Pharmacology, and it was titled "Professional Athletes Suffering from Familial Hypercholesterolemia Rarely Tolerate Statin Treatment Because of Muscular Problems." They say these findings indicate that in top sports performers, only about 20% can tolerate a statin treatment without any kind of side effect. And if you look at a professional athlete, professional athletes are the ones who are using their body, they're using their muscles, they probably are training year round, and they're using their muscles the most. So it appears that the people who are using their muscles the most can actually tolerate the treatment even less. And so a paltry number of professional athletes were able to tolerate statin medication only because the more they use their muscles, the more side effects they start to actually start to experience. But if you have an issue, usually the doctor's like, well, let's just try a different one. Let's just try a different one. Now, I will also say this. Well, if you want to really get down to the nitty gritty of any kind of vascular disease, if you want to really fight vascular disease, then one of the things that you could do is just kill off the macrophages or the dendritic cells, because those are the ones that are producing plaquing. You have that LDL that digs into the endothelial lining, and it causes an inflammatory response. The macrophages come, they just try to clean it up, and it causes plaquing. So it causes plaquing and fatty deposits that are then calcifying within those arteries. And this is how they treat autoimmunity too. So if someone's got an autoimmune reaction, they're giving them corticosteroids to just kill off the immune system. And the reality is, if you're talking about heart disease, or if you're talking about any kind of vascular disease, then why don't we just kill off some of the cells that are responsible for producing atherosclerotic plaquing, like the macrophages? Well, the problem is with this. If you killed off the macrophages, you probably would die very soon of some kind of infection, because you need the macrophages in order to fight as first responders and antigen presenting cells, to certain pathogens. So it has a role in infection. So if you decide I'm just going to kill all those off and all my problems are solved, well, you probably will die of infection first. So what's one of the answers? Well, this is why one of the reasons why I have to talk about it is because I see people come in and they're suffering from fatigue, or they're suffering from muscular adverse events or something. The first thing I'm looking at is, are they on any kind of statin drug? And will I recommend CoQ10 for those people? Absolutely, 100% I will. But when someone says, oh, I tried CoQ10 and didn't get my energy back, I'm like, well, there's another reason why, because there's multiple different reasons why someone cannot have energy or fatigue. In fact, anytime that you're running high amounts of inflammation, your cortisol, which is giving you energy, can convert into cortisone. And that's why people can feel so tired and fatigued. So if you look at this from Complementary Therapeutic Modalities 2019, so this article is about 6 years old, the effect of coenzyme Q10 supplementation on fatigue, a systematic review of interventional studies. Here's what they say. A number of studies have examined the beneficial effect of coenzyme Q10 on fatigue. Their conclusion is this: it seems CoQ10 has better therapeutic effects in statin-related fatigue and fibromyalgia patients compared with other disease-related fatigue. So if that is the main issue, then CoQ10 can absolutely help with fatigue. In fact, people ask me, do I take CoQ10? Yes, I do. I will take anywhere from 125 to 300 milligrams per day. I will take CoQ10, okay? So, but if you look at this, one of the things that they always say is more trials. We need more trials. We need more trials. And you know why pharmaceutical companies don't do any trials? And this has to do with the video I did on thiamine, because talk about diabetic neuropathy and how those people need massive amounts of thiamine. The pharmaceutical companies don't do any kind of trials on this. And the reason why is because they can't patent a natural solution. They need to make it into some kind of new and novel drug. So they don't want to spend a lot of money researching things that they can never turn into a drug, because a pharmaceutical company never wants to fund a study that they can't patent a drug. So they don't want to put all the money in because they have a fiduciary responsibility to their shareholders. So why on earth would they do more trials when you can't patent the solution as a drug? So they don't want to fund any studies in regards to that. And that's why you're not going to see a lot of studies, and you can't hang your hat like, oh, yeah, the science is all about drugs and stuff now. Well, they're doing the studies in order to patent their drugs. So here's another article from the International Journal of International Journal of Molecular Science. Disorders of human coenzyme Q10 metabolism, an overview. Now listen to what they say. In statin therapy, deficiency in CoQ10 status has been suggested as possible contributing factor to the myopathic or the muscle aching side effects associated with this drug or pharmacotherapy. The decrease in circulatory CoQ10 status following statin therapy may reflect a decrease in blood low density lipoprotein status induced by this pharmacotherapy or this drug. Now, this is what's so interesting is what carries CoQ10 to the muscle tissue. It's actually LDL. They say LDL is the major carrier of CoQ10 in the circulation. Isn't that interesting? So the very thing that you need to deliver LDL to the muscles to be used during energy formation, when doctors are trying to lower this down to just ungodly amounts, LDL is the major carrier in order for that to happen. So you lower down your LDL to just ungodly amounts. Well, you don't have the bus in order to transport the CoQ10 to the target tissues. This is also true. You lower down, your cholesterol to just ungodly amounts. This is why you need cholesterol in order to be able to form the skin barrier. And that's why I see influencers online. They talk about the wonderful benefits of statin drugs, but they have to use a face filter in order to cover up their wrinkles and their lip sores and their angular cheilitis, the sores that you see on their mouth. I mean, it's just awful. I mean, these people look like they've been run over twice, like someone backed over them and then backed over them again. So this is why even cholesterol is needed in order to be able to make the skin barrier, which is why having dry, cracked skin, itchy skin can be one of the things, because the skin barrier can start to break down. But in order to get CoQ10 to the target tissues, LDL is one of the major carriers in circulation to get it to this target tissues. So just remember this is, when you are having side effects, if you go and look at that and you see how many people on the Instagram post were just talking about just terrible side effects, just remember this: no one can take away your experience, because anything else, doctors trying to take away your experience or they're not listening to you, that's just a form of gaslighting. You know what gaslighting is? It's belittling the victim to preserve your ego. And that's why when people come in and they say, I'm experiencing this, this, and this, one of the most powerful things I'll tell people is, you know what? I believe you. There's probably a lot of people, they don't understand why this would happening, but I believe why that could happen. The problem is that doctors, because they lack such an understanding of physiology and they lack such an understanding other than just give this for that, is that people come in with so many different symptoms that are going on. They don't understand what's going on. They don't understand why their medication is not working, why it has so many side effects. And they just belittle the person in order to preserve their current way of thinking. That's called gaslighting. And I think in healthcare, it really needs to stop. Now, just remember this: I'd rather have my quality of life than lay in bed debilitated with a 5-year, 1% absolute risk reduction. And in fact, anytime you're talking about a drug, you need to look at the NNT. In fact, anytime a doctor wants to put you on a drug, say, Doc, what's the NNT? What's the number needed to treat in order to have the desired outcome? And if you look at the NNT of statins, the 5-year absolute risk reduction is 1%. 1%. The relative risk reduction, which is relative, is 33%. But if you look at the absolute risk, take 100 people, put them on a statin drug for 5 years, and only one person has an absolute risk reduction. Here's the problem: when you have a 1% absolute risk reduction, but you have as many as 40% of people that are experiencing terrible, debilitating fatigue and muscular exertional fatigue, or exertional fatigue meaning they do any kind of tough workout and they're laying in bed for the 2 or 3 days. The very things that they need to do in order to get healthier, this drug is actually preventing that from happening. I think it's an absolute sham that we aren't talking about it more. But people will say, oh, at least I didn't have a heart attack at 50 to 60 years of age. And then I look at their profile picture and you just see that they're just crumbling. And this is why we talk about, the fireman versus the carpenter principle, because there's so many people who brag that they don't have a fire, yet their body, that their spirit is living in, is just crumbling from the inside out. And that's why they're like, well, I'm not dead yet, but this is what my house looks like. And this is what we talk about when we talk about the fireman versus the carpenter principle, is that if your house is on fire, then call the fire department and have them come in, sprinkle your house with water. They're going to bust down the doors. They're going to bust down the windows. The water isn't good for your house. But the problem is what you do afterwards makes all the difference. And in fact, after you have a fire department come and put out the fire, sprinkling that house with more fire every single day is just going to make your house decay, crumble, and rot, which is why you have so many people, once they go down into that paradigm, they add more and more drugs. And yes, we're living longer than ever before, but we're also living sicker longer than ever before. But no one comes in and says, let's figure out why this happened. And let's start to restore your body back to normal so that you're just not living in a sick, dead, decaying, dying house that's inhospitable when you're in your 50s and 60s and 70s. This is why, guys, the inflammation talk is so important. Our next one's going to be on Tuesday, March 18th. This is tomorrow night at 6 o'clock p.m. This is an in-person event if you're from the Chicagoland area. Please make sure that you get registered for that. And if you get registered tonight, my staff probably tomorrow will reach out to you tomorrow to confirm your attendance at that event. We have a gift for you at that event. Also, when you come in, make sure you take a shot of California Poppy. I'll explain why. So get registered for that event. And if you're someone who deals with weight loss resistance, cancer, problems with your fertility, hormones, thyroid disease, arthritis, blood sugar issues, autoimmune conditions, and any issues in regards to your hormones, get to the reason why. Because, guys, one of the most underlying effects is a chronic, unrelenting inflammatory issue that's going on. Now you need to figure out where on earth it's happening. Gastrointestinal system, what's going on with the immune system? Is it a food? I mean, there's so many different things that you have to look at, but this is why we want to bridge the gap so you know exactly where you need to start in order to start clearing a path towards a better, healthier you. So make sure that you get registered for that right now. Now, if you go to our link tree, you click on that, you'll be able to register for that inflammation event right at the top. But I know anytime I don't give people, like, here's kind of a working solution to do right now, people yell at me. All right. So do I recommend taking CoQ10? Yes, I recommend if you're on a statin drug, you should be on CoQ10. And this is why, yes, you can get CoQ10 from taking it in supplement form. You can also get it from organ meats as well, but you'll get in a lot higher amounts if you're doing something like Q Power Plus. If you go over there on our link tree, you'll be able to go to the Wellness Way store. And if you get that, just make sure to activate that and to give permission for you to be able to order it. Just enter in the code 5058, and that will give you access to that specific supplement as well. So you can go there and you can order it. And I definitely recommend it if people are on any form of statin drugs, as well, only because we know physiologically it's just inhibiting the production of it because of how it blocks certain pathways as they head downstream. Now you can also watch the 5-part series with Dr. Patrick Flynn. If you've never heard of him, fantastic speaker. He'll captivate you for the whole entire time. But if you go to wellnessway.com/ADP, you'll be able to find that. You'll be able to play it directly from the website, and lots of awesome clinical information. And I think you'll enjoy it as well. But this will provide some of the foundational support for your decision on what you want to do, either yay or nay. So the thing is that, people ask me what on earth I'm going to do. I'm like, I'll just give you the information, you decide. And Dr. Patrick Flynn gives you the information as far as what you need to be doing in order to start helping you. And it all comes from a very scientific perspective as well. So statins and fatigue, do they cause fatigue? They can be one of the contributing factors. There's no doubt about it. And hopefully over the last several minutes, I went over clearly why that can be the case. Although probably a lot of people, who had a negative comment, they're not on here to watch it. They don't want their opinion changed. They only want their opinion validated. just remember, anybody who has an opinion against a certain medication or has an opinion against a vaccine, we're not anti. We just say, hey, I was for it. And then because of what happened, or actually going and researching, looking at things, now I'm actually against it. I don't see the clinical benefit with doing that. So, do statins cause fatigue? Absolutely. Make sure you watch all of that. Watch this all the way through. Let me also know that you're watching too. And then make sure you watch all of the different perspective ADP at thewellnessway.com. You can check out Dr. Patrick and what he has to say about all of that. Because I'm going to tell you this, it's not going to go against anything that I'm saying right now, but this will provide a lot of scientific backing as far as why we say some of the things that we say as well. So statins and fatigue, is it real? Absolutely. I just showed you why. So join me next week for our next live broadcast. And if you have any suggestions or anything like that, just make sure you leave that in the comments below. But guys, thank you so much for watching. It's good to be back. I wasn't sure if I'd be able to be back, but I am. And I'll be back next week with a brand new topic. Even if it's a question and answer, I'm unsure yet, but a lot of times I don't get the motivation to come up with a topic until, like Friday or something like that. So give me a suggestion as far as what you would like to learn about in the comments. So guys, I appreciate you watching this video. Please make sure that you follow us. Please make sure that you share this video too. And appreciate you watching. Be well, be blessed. Remember who you are. I appreciate and love all of you. And I hope you have a great rest of your St. Patty's Day. Be well.